Hi, this is Dr. Ken Richter from Scotland Family Medicine Direct Primary Care. I wanted to kind of update you guys on the most recent thing about COVID testing, kind of give you an indication of where we are and what's ahead of us. So as we're getting more areas reopened, we're going to be faced with changes in how we approach this new reality. One thing for sure is we are going to be helped with testing. I know you have heard much in the news about testing and what is available and what can be done. So here's a summary of what we know now. First of all, why do we test? First, it's going to help limit the spread of the virus. It will determine whether someone is contagious and needs to be quarantined. It's also going to help manage populations and help to reestablish people going back to work. We can understand the true prevalence and natural history of COVID-19 with more testing. So what is the test? Well, the one test for an active infection deals with viral RNA. This test is done with a nasal or oral swab and will detect whether you are currently infected. Now, the rapid test, point of care test, is not available in large numbers. So usually it's a 3 to 5 day waiting time after you get the test to know whether you're positive or negative, which means you may have to stay home until that test is known. The antibody test, which is being developed, and we're getting news right now that should be available very, very shortly. This will test whether you have past exposure to COVID and will identify who is free of the infection and who can return to workplace. This is a blood test that's drawn and then sent to the lab. Here's the problem. When the FDA announced in March that they needed testing, 160 antibody tests were allowed on the market without proof that they were accurate. In May, it was discovered that many of these tests were fraudulent, and the FDA had to institute tighter policies. Now, 11 vendors have been given the permission to develop testing. So, the big message is that with everything learned, we still have to be very cautious with all of that information. Here is another point to consider. If I test positive with the antibody test, does that show that I'm immune? Am I protected against getting the infection? The most recent information would show that you would be immune after being infected, a primary infection, and would most likely not get reinfected. Now, many of you have heard of herd immunity. So the idea is that if most people would have the infection and then develop immunity, then it would no longer spread. To reach herd immunity with COVID-19, it would require 70% of the population of the United States to become immune. With no vaccine, you would need 200 million Americans to be infected. At the current rate of 25,000 cases per day, it would take well into 2021 to reach that number, and over 500,000 Americans would die. So what's in our future? Social distancing will be here for a while, and realistically, I don't expect anyone can know what our post-COVID-19 life will look like. Vaccines will become available, and we will do our best to relax the current restrictions and lifestyle changes as those immunizations become more available and more people become immune. More testing will be available, and will be more extensive to show many more infections and weaknesses in our systems. So for now, we have to continue to stay safe. We have to follow protective recommendations. We will absolutely get through this. But in the meantime, Scotland Family Medicine Direct Primary Care is here for you. We've not stopped seeing patients or working with telemedicine or virtual visits, so give us a call if you need us. I hope this is a big help. I'll try to keep these things coming as much to keep you up to date as we are being updated. In the meantime, take care, and we will see you soon. This is Dr. Ken Richter, Scotland Family Medicine Direct Primary Care, and your curbside consult. Thank you.